Did you know that kidney stones affect about 1 in 10 people at some point in their lives? What's concerning is that the symptoms of kidney stones can be subtle and easy to miss. You might experience dull back pain, blood in your urine, or frequent urination, which could be silent signals of kidney stones. Ignoring these signs can lead to serious complications such as kidney damage, urinary tract infections, and even kidney failure. But don't worry, catching these signs early and seeking medical attention can make a huge difference in preventing these complications and protecting your long-term health. In this video, let's have a look at some silent signs of kidney stones that you should never ignore. Stay tuned till the end to learn about how to recognize these signs and prevent serious consequences. Number 1. Back pain. Kidney pain can be one of the most unbearable experiences you can imagine. It's often described as a sharp, stabbing sensation, similar to a knife wound. In fact, surveys show that nearly 500,000 people visit the emergency room for kidney stones every year in the United States alone. This intense pain occurs when a stone gets stuck in your ureter, which is the thin tube that carries urine from your kidney to your bladder. When the stone blocks urine flow, it causes pressure to build up in your kidney, triggering the pain receptors and sending intense pain signals to your brain. One of the most unpredictable things about kidney stone pain is that it can start suddenly and shift location and intensity as the stone moves around. You might feel waves of pain, which can worsen as your ureter muscles contract to push the stone out. This pain can radiate to different areas of your body, including your side and back, below your ribs, and even to your abdomen or groin. It's important to remember that the size of the kidney stone doesn't always dictate the severity of the pain. Even small stones can cause extreme discomfort as they move or block your urinary tract. Research suggests that around 30% of stones smaller than 5 millimeters cause significant pain. Ignoring kidney stone pain can have serious consequences. While the pain itself might come and go, the stone won't just disappear on its own. As the stone moves or remains lodged, the pain can become increasingly severe and frequent, which may require emergency medical attention. Blockage by the stone can create a stagnant environment, increasing the risk of urinary tract infections. Prolonged blockage can put immense pressure on your kidney, potentially leading to permanent damage and reduced function. In fact, studies show that up to 15% of individuals with untreated stones develop chronic kidney disease within 5 years. It's important to keep in mind that once you've had kidney stones, you're at a higher risk of forming more in the future. Ignoring the initial episode increases the odds of future pain and potential complications. Repeated stones and infections can leave scar tissue in your kidney and urinary tract, further affecting kidney function and increasing the risk of future blockages. So, if you're experiencing any of these symptoms, it's important to seek medical attention right away. Number 2. Frequent urination. Do you ever feel like you constantly need to go to the bathroom, even if you only pass a small amount of urine each time? This could be a sign of kidney stones. When a stone blocks your lower urinary tract, it disrupts the normal flow of urine, which can irritate your bladder and cause a frequent urge to urinate. Studies suggest that about 40% of people with kidney stones experience this symptom. It's important to note that frequent urination can also occur with other conditions, but there are key differences. For instance, if you have a urinary tract infection, UTI, you might experience burning pain during urination, cloudy or strong-smelling urine, and pelvic pain. If you have type 2 diabetes, you might experience excessive thirst, unexplained weight loss, and fatigue. However, with kidney stones, you might also experience kidney pain and other signs that you'll see as we move forward. Regardless of the cause, experiencing frequent urination consistently warrants a doctor's visit. Early diagnosis and treatment of kidney stones can prevent complications like infections and kidney damage. Additionally, ruling out other potential causes like UTIs or diabetes is crucial. So, if you're experiencing frequent urination, don't hesitate to talk to your doctor about it. Number 3. Blood in urine. Blood in the urine, also known as hematuria, is a common sign of kidney stones. It can be alarming to see red, pink, or brown urine, but it's essential to seek medical attention as soon as possible. Studies have shown that around 60% of people with kidney stones experience hematuria. This happens when the sharp edges of the stone irritate or scratch the lining of your urinary tract, causing bleeding. The color of the urine can vary depending on the amount and location of the bleeding. For instance, fresh blood from lower urinary tract bleeding is usually red, diluted blood is pink, and older blood that has spent a long time inside your body and has been oxidized is brown too. It's important to note that blood in your urine doesn't always mean you have kidney stones. Other conditions like UTIs or bladder cancer can also cause blood in the urine. Therefore, if you notice blood in your urine, don't panic, but don't ignore it either. The most important step is to see a doctor. They will perform a simple urine test to confirm the presence of blood and determine the cause. Number 4. Cloudy or smelly urine. Have you ever noticed that your urine appears cloudy or has a foul odor? If so, it could be a sign that you have kidney stones. Kidney stones, while passing or being stuck in your urinary tract, can cause irritation and inflammation in there. This creates an environment that promotes the growth of bacteria that cause urinary tract infections, UTIs. This can cause your urine to become cloudy due to the presence of pus, which is produced by your body while fighting the infection. Additionally, certain kinds of bacteria associated with UTIs produce specific smells that are quite noticeable. It's essential to pay attention to any changes in your urine, especially if you have kidney stones. Research shows that around 16% of people with kidney stones also develop a UTI. Even if you don't have a fever, which is a common UTI symptom, it's crucial to see a doctor immediately if you notice cloudiness, foul odor, or any other concerns with your urine. Concentrated urine, which can happen when you're dehydrated, may also have a stronger odor, but this is typically harmless. Early diagnosis and treatment of UTIs, especially alongside kidney stones, can prevent complications like kidney damage. Number 5. Burning sensation during urination. Kidney stones can also cause a burning sensation during urination, also known as dysuria. The primary reason for this is that as the kidney stone travels down your urinary tract, it can scratch and irritate the delicate lining of your ureters. This irritation triggers nerve signals that your brain interprets as a burning sensation. Studies show that roughly 50% of people with kidney stones experience dysuria. However, sometimes the stone itself isn't the only culprit. The blockage or inflammation it creates can trap bacteria in your urinary tract, leading to an infection. This infection, not the stone itself, can also cause a burning sensation. Number 6. Decreased urine output. Do you find yourself running to the bathroom frequently, but only passing a small amount of urine each time? If yes, then this could be a sign of a blocked kidney stone. When a kidney stone gets stuck in your ureter, a thin tube that carries urine from the kidney to the bladder, it can partially or completely block the flow of urine. This blockage creates a backup of urine in your kidney, triggering the urge to urinate frequently. However, the actual amount of urine you pass might be very little due to the obstruction. Studies show that around 20 to 30% of people with kidney stones experience frequent urination with little output. It is essential to note that other conditions can cause similar symptoms, so seeking medical advice is crucial. Number 7. Upset stomach. Kidney stones can cause a lot of pain, and it's not just limited to the back area. Many people with kidney stones experience nausea and vomiting too. This is because the kidneys and digestive system are connected through nerves, And when a stone irritates the kidney, it indirectly triggers the nerve receptors in the stomach too, resulting in these symptoms. Studies have shown that around 30 to 40% of people with kidney stones have experienced these symptoms. But why does the pain from a kidney stone cause nausea and vomiting? Well, when you experience severe pain, regardless of where it is located, your body's stress response is activated. This results in the release of hormones, such as adrenaline and cortisol, which disrupt the communication between your gut and brain. This disruption can lead to nausea, vomiting, and other digestive issues. In other words, the intense pain from a kidney stone can indirectly lead to a lot of distress, both physically and psychologically. Number 8. Restlessness and difficulty sleeping. Kidney stones can cause intense pain and discomfort. The pain can be so severe that it can make it difficult for you to settle down and get a good night's sleep. In fact, studies suggest that around 40% of people with kidney stones experience sleep disturbances. One of the reasons why kidney stones can disrupt your sleep is by triggering your body's stress response. This, in turn, releases hormones like cortisol and adrenaline, which keep you wired and alert, making it hard to sleep. Additionally, kidney stones can block the normal flow of urine, leading to frequent urination throughout the night. This constant need to rush to the bathroom disrupts sleep cycles and leaves you feeling exhausted. While occasional sleepless nights happen to everyone, persistent sleep problems alongside other kidney stone symptoms shouldn't be ignored. It's important to note that sleep deprivation can weaken your immune system, making you more susceptible to infections, including UTIs that often accompany kidney stones. Poor sleep can also worsen pain perception, often making the kidney stone pain feel even more intense and sudden. Number 9. Rising temperatures and chills. When a kidney stone gets stuck, it can lead to an infection in your urinary tract or even kidneys. This infection triggers your immune system, and your body sends white blood cells to battle the invaders. As these white blood cells fight, they release chemicals called pyrogens. These act like tiny messengers, signaling your body to raise its temperature. If your body temperature rises too quickly, it can trigger chills, your body's way of trying to cool down and maintain balance. Research shows that around 10 to 15% of people with kidney stones experience fever and chills. While kidney stones can cause this, it's important to remember that fever and pain are not exclusive to kidney stones. So it's essential to seek medical attention if you experience fever and chills in addition to other symptoms like pain or discomfort while urinating, nausea, or vomiting. Your healthcare provider can diagnose the underlying cause of your symptoms and recommend appropriate treatment. Number 10. Fluid imbalances. Kidney stones can cause dehydration because they can lead to increased urination and sweating. When you have a kidney stone, your body may try to flush it out by producing more urine, which can lead to dehydration if you do not drink enough water to replenish the fluids lost. Plus, kidney stones can cause sweating due to pain or fever too, further contributing to dehydration. On the other hand, kidney stones can also cause edema, which is the swelling of body tissues due to the accumulation of fluid. This can happen when the stone obstructs the flow of urine, causing urine to back up into the kidney and leading to swelling. Edema can also occur if the stone is blocking the ureter, which is the tube that carries urine from the kidney to the bladder, causing urine to accumulate in the affected kidney. Studies suggest that around 20 to 30% of people with kidney stones experience symptoms such as dehydration, fatigue, and weakness. Edema, however, is less common and occurs in only a small percentage of people with kidney stones. It's important to remember that not everyone will experience these symptoms, and some people may experience different symptoms altogether. If you are experiencing any symptoms that concern you, it's important to seek medical attention as soon as possible. Here are some effective strategies to help manage your symptoms of kidney stones. Number 1. Stay hydrated. One of the most effective ways to prevent kidney stones is to stay hydrated. Studies show that low urine volume is a major risk factor for kidney stone formation. Drinking plenty of water helps to dilute your urine, which prevents substances from becoming concentrated and crystallizing. Adequate hydration also helps to prevent calcium crystals from sticking together, which is a key step in the formation of kidney stones. Number 2, citrus fruits. Citrus fruits like lemons and oranges are a natural inhibitor of stone formation. They contain citrate, which binds to calcium in your urine, preventing it from forming crystals that can clump together into stones. Other citrus options include grapefruits and limes. Number 3, limit salt and animal protein. Both salt and animal protein can contribute to kidney stone formation, particularly for people who have a history of kidney stones. Similarly, animal protein tends to create an acidic urine environment that promotes stone formation, so avoid consuming both these things too much. If you like this video, give us a thumbs up and share it with everyone you care about. Thanks for watching, and see you in the next video.